And Rashad and Desmi, tell us a little bit more about CliniSpan and how it came to be.
Yep. So myself and Rashad and our third co-founder is Dr. David Lipsitz. So I think I speak for myself and Rashad. I really feel like we experienced the kind of the patient side of this, where we saw family members who were taking drugs that affected them adversely. And they would take improper dosage amounts, see those inadvertent side effects. And I would say for myself, I didn't really realize the origin of that problem when I was growing up and seeing this experience. And then we met David, and David experienced it from the physician side, where he saw patients who came in and he would give them drugs that affected them adversely, and they would take improper amounts. And I think, both of those views, we really saw it from both sides, and we really felt like, with David's physician experience and exposure, and our experience and exposure on the patient side, that we really could, create something to address this. And that's what CliniSpan Health is. And we really feel like, it's very similar to Allison and Community Expert Solutions, I would say, in that community culture is really core to what we do. It's really core to getting people involved in medical research. Community culture, I think, would be a phrase that I would say is the most important in the work we've done. Being able to relate to someone and how they live their lives is really important in us trying to come in and insert medical research into that. So knowing their community culture is really important for being able to insert medical research into their everyday lives. And so that's what CliniSpan Health is about.
Des, from your standpoint, Dr. Matthews raises a good point about trust. So you have accessibility, you have trust. Which do you think is going to be the most important to tackle first, or do they need to be tackled simultaneously because they're just such huge factors in participation?
Yeah, so I think trust and accessibility are both about equally important. And I would really say that trust comes first, because the rapport that you build with the patient, the potential patient, leaves them open to being educated about clinical trials, and open to exploring access. And so once you have that trust built with them, that you then become partners in trying to create accessibility. And I think it would be harder to try to create access, together with someone who they don't have trust with you, and you might not have trust with them. And so I really think that, they definitely both are necessary, but I think trust would definitely precede accessibility.